Today we'll be explaining Huntington's disease and its effects on the human body, specifically motor control. Huntington's disease is a rare inherited autosomal dominant disorder on chromosome 4. It is a progressive disease causing the breakdown of degeneration of nerve cells found within the brain. Huntington's disease mainly affects functional ability, resulting in movement, cognitive, and psychiatric disorders often developing between 30 and 40 years of age. Juvenile Huntington's disease, another form of the disease, develops prior to 20 years of age, and progression of the disease is usually faster and more fatal. The life expectancy of patients with Huntington's disease is 10 to 30 years following the onset of the patient's first symptom.
Hey, how are you? I'm here for my appointment.
No problem, just sign right here and we'll get somebody to see you.
Thank you.
Thank you.
Hi, my name is Jules. What's your name?
Corey.
Nice to meet you.
Nice to meet you too.
What brings you in today?
So I've been having tremors lately. I just kind of want to come get them checked.
Okay. How old are you?
I'm 32.
Okay. So when did you start experiencing these symptoms?
I think like 4 to 5 months ago.
Okay. And does any of your family members have Huntington's disease by possibility?
I think my mom and my dad might. They
Okay.
show symptoms for sure.
Okay. And have you ever done genetic testing for Huntington's disease?
No.
Okay. So we're going to start doing some diagnostic testing for the patient to test their neurological symptoms. First, I'll be testing the patient's eyes, looking for any slow or unusual movements. Next, I will be testing the patient's reflexes, looking for any slow or absence of response in the knee, biceps, or triceps. Next, I will be testing the patient's strength, balance, and coordination to determine the stage of disease progression. All right, I'm gonna have you squeeze my fingers as hard as you can. Okay. And then have to push your hands like this. Push up against me. Okay, like this. Push out against me. Push in. Alright. And then push out against me. And pull back. Okay. I'm gonna have you stand on your right foot and balance for 5 seconds. Okay, on your left foot. And then I'm gonna have you walk a straight line to the back of the room and then coming back towards me. Following neurological testing, I will begin psychological testing. First, I will test the patient's language and then his memory skills. All right, there's a sentence on the top of this page. I want you to read it back to me.
The girl went to the park with her dog and threw a ball.
I'm gonna read a list of 5 words to you and you repeat them back to me in any order.
Okay.
Apple, wheel, shark, balloon, fence.
Apple, shark.
Any others? Okay, I'm gonna do it one more time. Apple, wheel, shark, balloon, fence.
Apple, shark, wheel.
Any more?
No, I can't remember.
Okay, I'm going to refer you for an MRI and CT scan to look at any of your neurological and metabolic functionings of the brain in order to determine the status of your disease progression. The most common motor symptoms seen in patients with Huntington disease includes chorea, which is involuntary jerking or writhing movements, rigidity or muscle contractures, slow or unusual eye movements, impaired gait, posture or balance, and difficulty swallowing. Common cognitive symptoms include difficulty organizing, prioritizing, or focusing, the patient being stuck on thoughts, behavior, or actions, lack of impulse control, lack of awareness of behavior, slow thought processing, and difficulty learning new information. Some psychiatric disorders that may present themselves as secondary diagnoses following Huntington's disease include depression, insomnia, fatigue, OCD, mania, and bipolar disorder. Weight loss is also another common symptom of Huntington's disease.
Hi, I'm Andrea. Come into the office. I'll be your physical therapist.
How are you? I'm Corey.
Nice to meet you.
Hi, I'm Damaris, Corey's caregiver.
Okay, you can have a seat right here.
Thanks.
Your provider sent over some information with you. I see you're taking tetrabenazine. Does that seem to be helping with your motor function?
Yes.
A little?
A little.
Okay, good. So to improve your motor function even more and keep your quality of life up, we're going to begin physical therapy with you.
Okay.
The most common causes of death in people with Huntington's disease is pneumonia or other infection, fall-related injuries, and complications related to inability to swallow. The overall goal of physical therapy is to enhance fitness and wellness, prescribe assistance devices, educate support caregivers, and establish home exercise programs. The goal for your therapy is to have you engaging in 150 minutes of moderate activity each week. This can include walking, stationary biking, anything that gets you up and keeps you moving. You're still in the early stage of Huntington's, so we just want to work on your strength, your balance, core stability, and gait. Once you reach the mid stages, because this is a progressive disease, you'll be working on being mobile, maintaining your quality of life, promoting relaxation strategies, and safety. Once you reach the late stages, therapy will promote patient comfort, fall prevention, and establishing a home care routine. You may be confined to your bed, so your caregiver is going to be very important in your therapy. Okay, so to start your therapy off today, we're going to have you just walk. This is how you're going to start your therapy off most times. So if you want to just stand up and your caregiver can help you. We want you to walk it on your own as much as possible if you're able. So instead of hanging on to him, you're kind of just going to come around and just guide him, make sure he doesn't fall. If you see him slip or stumble at all, then you're going to grab onto him. But we really want you walking as much as you can on your own. Good job. Good. Because your motor control is so important in therapy, we want to work on making precise motor movements. So for this therapy exercise, you're going to take the ball, grab it with one hand, pass it to your other hand, and place it on the X. Okay, so you want to try that? Good. Good, nice. And again. Good. The next therapy exercise we're going to do is walking up the stairs. This is very important for home care. So what we're going to have you do is make sure you're steady and try and walk up the stairs. It's important that the caregiver stays close behind. Good. Try not to hold on to the railing. Good.
Overall, Huntington's disease is a fatal inherited condition, but the onset of the disease can be predicted with genetic testing and counseling. Though there is no cure for the disease, an early indication of development may provide the patient with a longer life expectancy by beginning medical treatment to slow the progression or decrease symptoms of the disease.
The goal of your therapy is to have you engaging in about 115 minutes. Corey!
Fence.
Any more?
Wheel.
Oh, just say no!
No, you gotta start over.
Balance and coordination. I can't speak.
Start over. All right, I'm locked in now.